Hello everyone, my name is Ben Washington. I am the principal agent for Primary Health Agency. Before we get started, I have to say these three words. Primary Health Agency is not connected with or endorsed by U.S. government, federal Medicare program, Social Security, or any other government agency. I am a licensed benefit advisor. I'm here to answer your Medicare questions. So let's get started. I'm turning 65 in 4 months. How do I get started in Medicare? Good question. Getting started with Medicare. Most people ask, will I get Part A and Part B automatically? If you're already getting benefits from Social Security or the Railroad Retirement Board, RRB, you will automatically get Part A and Part B starting the first day of the month you turn 65. If your birthday is on the first day of the month, Part A and B starts the first day of the prior month. If you're under 65 and have disability, you'll automatically get Part A and B after you get disability benefits for Social Security or a certain disability benefit from the RRB for 24 months. If you have ALS, called Lou Gehrig's disease, you will get Part A and Part B automatically the month your Social Security disability begins. If you automatically get Medicare, you'll get your red and white, blue, and Medicare card in the mail 3 months before your 65th birthday or the 25th month of disability benefits. And you don't need to pay a premium for Part A, sometimes called premium-free Part A. Most people choose to keep Part B. If you don't want Part B, let Medicare know before the coverage start date or your Medicare card. If you do nothing, you'll keep Part B and will have to pay the Part B premium through your Social Security benefit. If you need help deciding if you should keep Part B, see Medicare and You booklet. If you choose not to keep Part B but decide to want it later, you may have to delay in getting Medicare for Part B, and you may have to pay a late enrollment penalty for as long as you have Part B.
Will I have to sign up for Part A and or Part B?
If you are close to 65 but not getting your Social Security or Railroad Retirement Board RRB benefit, you will need to sign up for Medicare. Visit ssa.gov/benefit/Medicare to apply for Part A and Part B. You can also contact Social Security 3 months before you turn 65 to set up an appointment. If you worked it for the Railroad Retirement, contact RRB in most cases. If you don't sign up for Part B when you are first eligible, you may have to delay in getting your Medicare Part B coverage in the future, and you may have to pay a late enrollment penalty for as long as you have Part B. See your Medicare and You handbook. I have other health coverage. Should I get Part B? This information can help you decide if you should get Part B based upon the type of health coverage you may have, employer or union coverage, if you or your spouse or family member, if you have a disability, are still working and you have health coverage through the employer or union. See Medicare Handbook to find out how coverage works with Medicare. You can also contact the employer or union benefits administration for information. This includes federal or state employment and active duty military service. It might be to your advantage to delay Part B. Enroll while you still have health coverage based on your or your spouse's current employment. Coverage based on the current employment doesn't include COBRA, retiree coverage, VA coverage, individual health insurance coverage, like through the health insurance marketplace. TRICARE. If you have TRICARE, healthcare program for active duty and retired service members and their families, you are generally must sign up for Part A and Part B when you are first eligible to keep your TRICARE coverage. However, if you are an active duty service member or an active duty family member, you don't have to sign up for Part B to keep your TRICARE coverage. For more information, contact your TRICARE contractor. See the Medicare Handbook. What are the parts of Medicare? What are the parts of Medicare? Part A, hospital insurance. It helps covers inpatient care in hospital, skilled nursing facility care, hospital care, and home health care. Also, you have Part B, called medical insurance. It helps covers services from doctors and from healthcare providers, outpatient care, home health care, durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment. Many preventive services like screenings, shots, or vaccines are yearly well visits. Then you have Part D, drug coverage. Help covers the cost of prescription drugs, including many recommended shots or vaccines. Plans offer Medicare drug coverage. Part D are run by private insurance companies that follow rules set by Medicare. What are my Medicare options? Your Medicare option. Original Medicare. Original Medicare includes Medicare Part A, hospital insurance, and Part B, medical insurance. You can join a separate Medicare drug plan to get your Medicare drug coverage. Part D. You can use any doctor or hospital that takes Medicare anywhere in the U.S. to help pay your out-of-pocket costs in original Medicare, like your 20% co-insurance. You can also shop for and buy a supplemental coverage. You can add a Part D. You can also add supplemental coverage. This includes Medicare supplemental insurance called a Medigap. See your Medicare You handbook to learn more about Medigap, or you can use coverage from a former employer or union or Medicaid. Your second Medicare option is a Medicare Advantage, also known as Part C. Medicare Advantage is a Medicare approved plan from a private company that offer an alternative to original Medicare for your health and drug coverage. These bundle plans include Part A and Part B, and usually Part D. In most cases, you can only use doctors who are in the plan's network. In many cases, you may need to get approval from your plan before it covers certain drugs or services. Plans may have lower out-of-pocket costs than original Medicare. Plans may offer some extra benefits that original Medicare doesn't cover, like vision, hearing, dental services. Medicare Part C includes both Part A and B, and most plans include Part D and some extra benefits. And some of them plans include a lower out-of-pocket cost.
Seriously.
Thanks everyone for coming out. Thanks again. I hope I answered all your questions. For a free consultation, go to www.conradhealthhc.com or 224-433-5754. We know that a Medicare Advantage plan may not be for everyone. Like a Medicare supplement is not for everyone. Original Medicare without a Medicare supplement or Medicaid can be very expensive because original Medicare plans does not have an out-of-pocket max. We know when you're on a fixed income, choosing the right Medicare option is important. Conrad's Health Agency will work with you to find a plan that will meet your needs and budget.